Good afternoon, and welcome to the second edition of Black Cambridge and COVID-19, which I am pleased to be co-moderating with my colleague, the Vice Chair of the Cambridge School Committee, Manikka Bowman. This is the second of a five-part series that we brought together, bringing experts in the field to talk about the COVID-19 pandemic and how it has disproportionately impacted people of color in Cambridge. So this week, we're focusing on illness and how that is impacting us in terms of physical and mental health. In a moment, I'm going to briefly introduce our extraordinary panelists, all who are incredibly busy combating this pandemic. And we cannot thank them enough for taking the time to join us today. But I first want to go quickly to my co-moderator, Vice Chair Manikka Bowman, to share her opening thoughts. Manikka?
Thank you, Councilor Simmons. It is indeed a privilege and an honor to continue this much needed conversation. You know, since the last time we came together on this platform, it seems as if the world kind of exploded, and we have so much to talk about in the context of COVID-19, the Black community, and Black pain that has become an intersection of us managing this global pandemic in our community. So I look forward to the conversation, and thank you to all of our panelists and everyone who has decided to join us this afternoon for this important conversation.
Thanks, Manikka. So I'm going to read your bio so that I don't make any mistakes. So Dr. JEANETTE CALLAHAN is the assistant professor at the Harvard Medical School and pediatrician at the Cambridge Health Alliance. She's the medical director of the Justice Resource Institute, Northeast Health Service Unit, providing primary care to justice-involved youth. She is also co-founder of the Wellness Collaborative, a nonprofit, interdisciplinary collective focused on promoting sustainable personal and community health, wellness, and resilience. Also with us is Dr. XENIA Johnson-Bembe. She is a board-certified psychiatrist in Brookline, Mass. She practices general, adult, and child and adolescent psychiatry, and she is the director of the Community Minority Affairs Office at the Cambridge Health Alliance Department of Psychiatry. Dr. Johnson-Bembe also sits on the board of RHEMBE, a supportive structure for low-income women managing depression. And in addition, Dr. CAMARA Jones. She's a family physician and I knew I was going to mess this word up, epidemiologist, whose work focuses on naming, measuring, and addressing the impacts of racism on health and well-being of the nation. She is a past president of the American Public Health Association, a senior fellow at Morehouse School of Medicine, and adjunct professor at the Rollins School of Public Health at Emory University. And in addition, we have CLAUDE-ALIX Jacob. CLAUDE-ALIX Jacob is currently serving his 13th year as the Chief Public Health Officer at the Cambridge Health Alliance in the city of Cambridge. His background is disease prevention, community advocacy, oral health, children's health, and youth violence. He was previously serving as the Deputy Director of the Office of Public Promotion, Health Promotion at the Illinois Department of Health. And in a moment, we are going to hear from Mr. Jacob, and he's going to give us a brief overview of where Cambridge stands in regards to this illness and where we're seeing the highest clusters of this illness to help frame our discussion. But before handing off to Mr. Jacob, I do want to encourage people who are watching to use the live Zoom feed to submit any questions that you'd like to ask of our panelists. And we're certainly trying to make those questions come in and be able to answer them in the next hour. So having said that, Claude Jacob, I'd like to turn the floor over to you and help us frame this conversation around COVID-19 and its impact on the Black community, specifically in Cambridge. And thank you again for your participation.
Thank you, and good afternoon, everyone. Really appreciate this invitation. So thank you to Manikka Bowman and Councilor Simmons for this wonderful opportunity. And I'm looking forward to a rich discussion with my peers, my panel, my colleagues here, to share at least a snapshot of what's happening here in Cambridge, but also to talk about the broader implications around COVID-19, this virus, and this global pandemic as it's impacting our communities. So just to tee it up for a couple of minutes and then jump into this discussion, just know, as Councilor Simmons mentioned, we have been in the midst of the storm for a couple of months now. The landscape, in case you're wondering, so to date, we're closing in on 2 million cases in the United States. Sadly, we've had over 100,000 individuals who have died from this virus across the country. In Massachusetts, we've had 103,000 reported cases and over 7,000 reported fatalities. And in Cambridge, just know that while we continue to amplify our testing, we have, as of this week, 1,027 Cambridge residents who have tested positive for this virus. And sadly, we've had 95 individuals, Cambridge residents, who have died of this disease. And so just wanted to share that while this ongoing pandemic continues, we're paying attention to not only our capabilities to support each and every one of you and the residents and our partners, but just know that we're watching how this is playing out around the globe. Just a couple other data points to share with folks. One is that if you look at our cities and towns, there's a lot of talk now about testing and amplifying the access to the COVID-19 test. Just know that if you look at our case counts and if you look at our positivity rates, if I look at our neighboring cities and towns and I talk about comparing us to Chelsea, for example, which is ground zero in the Commonwealth. So Chelsea has to date 2,779 reported cases, and that accounts for 40% positivity rate in that community. So just keep that in mind. Our neighbors right in Arlington, while they've had 300 reported cases, their positivity rate is at 12%. Our partners, our friends across the river in Boston. Boston is the largest urban center in the Commonwealth. They've had 13,000 cases in Boston, yet their positivity rate for COVID is 21%. And in Somerville, our neighbors to the north, while they've had over 800 reported cases as of June 3rd, they currently have 11% of positivity rate, and they've tested over 7,800 people. Why do I share that? For Cambridge, and this is the context of our conversation this afternoon, we're talking about the 1,000 cases that we've had. We have a positivity rate just shy of 8%. And mind you, we have been doing our due diligence and we've tested close to 12,000 people here in the city. So I say that to say that part of this conversation is about identifying the hotspots in the city, looking at the neighborhoods. We have done our due diligence, thanks in large part to the city manager's office, to make sure that this information is ready for residents on a daily basis. We provide maps that look at the neighborhoods, but also the zip codes. So we're going to talk a little bit about the context of what's happening in our backyard. I do want you to know that we are thankful and appreciative of the leadership. Mayor Siddiqui has been our strongest advocate to make sure that we have the resources available. City Manager DePasquale and his team have been fantastic. And recognizing Councilor Simmons as a resource who identified the need to have testing, for example, in the Port neighborhood. So this is to set it up to talk about the burden of this virus in our neighborhoods. But apples to apples, if you want to know in terms of the fatalities, just know that while we talk about the 95 deaths, 2/3 of those are attributed to the nursing homes. So 60% of our cases of the fatalities are among those who are white. We do see with our data that 10 of those deaths are attributed to members of the Black community, and just shy of that in terms of our Hispanic Latino counterparts. So we're going to talk more. This information will be made available for folks, but let's at least frame the context and we'll talk about the factors that are impacting our residents. Let me stop there and turn it over to Councilor Simmons.
Thanks, Claude. And thank you for that information, kind of giving us a baseline of what Cambridge looks like and also the surrounding cities and towns. One word that you used in your presentation, you said the burden. And when I think of burden, just recently, as I was prepping for this discussion today, a parent sent me a text in terms of feeling burdened. Now she's been sitting in the house with her kids 24/7 for the last, 7 weeks. And she's saying, how do I talk to my kids about it? And they're very worried about it. And that burden, and I mean, it's really a mental health issue here, where she's trying to figure out what's the way to have this conversation, particularly when the children vary in age, number one, or the children are young. Balance that, however, with the conversation that I have from another parent of a young son, 6 years old, that says, how do I explain? He was already worried about COVID and why can't I go to school? Now he's worried about what he sees on TV with this police action, this violence against Black bodies. You know, what would be, I would love to hear your thoughts around how do we talk to our kids about not only COVID-19, but balancing that with what's going on right now on our TVs every single day. And I just open the floor. Whoever wants to jump right in. I'm looking at Dr. Johnson because she's a psychiatrist in the group, and the floor is open.
I'll jump right in. And Councilwoman Simmons, thank you so much for this opportunity. Vice Chair Bowman, also thank you. And Mayor Siddiqui, a wonderful opportunity to have this important conversation about the Black community and this pandemic's effect on the Black community. You know, the mental health piece of this is really, it's interesting how this sort of highlights mental health in a way I think other illnesses and other experiences in our community have not. And it really does kind of come down to the inequities that exist in our social system. And those inequities then start to show up as the disparities that exist in the illness of the COVID-19 virus. And then, you know, when you think about that overall and think about how that then impacts the individual dealing with the pandemic and engaging with their children around the pandemic, you really do have to kind of consider the importance of the mental health piece. To talk about that with children, to have a frame of which is helpful, which is potentially also effective with children, you really do have to kind of start with the conversation around realism. You have to say that this is a reality that we live in. The reality is there is an illness, there's a virus that has infected our nation, and that because of certain circumstances has affected certain people more than others. And then you also then have to be frank about the realities of our social illness. You know, we talk a lot about social determinants of health, and we oftentimes in our medical community talk about the social determinants of health of individuals. Well, I actually think the COVID virus and the pandemic has actually elevated and highlighted the dysfunction in our social system, the social determinant of our social health. And this virus has actually done that. And certainly you want to be able to share that kind of information with your child as well, to say that there's also ways in which the way we live and we operate are not as healthy as we'd like them to be. And oftentimes when those health outcomes or those effects start to come down to individuals, we'll see things like deaths. We'll see things like injustices. We will see things like this disadvantages of one group for another group. And I would certainly be frank in having that kind of conversation with my child, specifically for Black children who stand at increased risk in this society.
Thank you, thank you. And you said inequities, and as soon as I heard the word inequities, Dr. Jones, CAMARA Jones, I thought of the work that you've done, and I know that Dr. Callahan's a pediatrician, so I really want to hear from the perspective of inequities from you, Dr. Jones, and then from you, Dr. Callahan. You work with children all the time, and what are you seeing, and what advice would you give to parents? But I want to turn it over to Dr. CAMARA Jones for a moment. Dr. Jones?
Well, so Dr. Callahan, do you want to go first? Because then I want to hit it hard. Okay, so.
He's so polite, so.
So it is important. So we have two things happening right now as reflected by the two questions sent to you, Councilor Simmons. We have the COVID-19 pandemic, which has disproportionately impacted Black and Brown and Indigenous people in this country. And it's not because we're more susceptible. It's not because we're less careful. It's not because, you know, we don't care about our health. It's because of racism. And then we have the killing almost 2 weeks ago by a police officer of George Floyd, so that's also racism in your face. So I would like to just share my screen very briefly and tell one of my teaching stories, an allegory that I use to help people understand that yes, racism exists, even if their whole life experience might seem to indicate that it does not. And this story is one of my allegories based on a real life experience. So let me tell you what happened in real life, but I already gave you the moral. The moral of the story is racism exists. So in my own real life as a medical student, first year medical student, very diligent. One Saturday, I am studying long and hard. And guess what happens? Some friends come over. So what do? We go to studying long and hard together, just hitting those books. It gets late. We get hungry, and I have no food in the apartment, which was typical. My friends understood. So they were like, never mind, Camara, let's go into town and find something to eat. So we go into town and we find a restaurant. We walk inside and we sit down and the menus are presented and we order our food and the food is served. Here we are eating. Not a very illuminating story yet. But as I sat there with my friends eating, I looked across the room and I noticed a sign, and that sign was a startling revelation to me about racism. So now I've intrigued you and you're like, Dr. Jones, what did the sign say? What did the sign say? The sign said open. So now I know I've lost many of you. So let me recap. Here we are sitting inside a restaurant eating. I look across the room. I see a sign that says open. If I hadn't thought anything more about it, I would have assumed that other hungry people could walk in, sit down, order their food and eat. But because I knew something about the two-sided nature of those signs, I recognized that now, because of the hour, the restaurant was indeed closed, and that other hungry people just a few feet away from me, but on the other side of the sign, would not be able to come in, sit down, order their food and eat. And that is when I understood that racism structures open, closed signs in our society, that racism structures, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there is a two-sided sign going on, because it is difficult for any of us to recognize a system of inequity that privileges us. So it's difficult for, here I have to move this thing, I see it's blocking. So it is difficult for men to recognize male privilege and sexism. It's difficult for white Americans to recognize white privilege and racism. Difficult for all Americans to recognize our American privilege in the global context. Yet those on the outside are very well aware there's a two-sided sign going on, because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard to know when you only see open. In fact, that's part of your privilege if you're inside that restaurant, not to have to know. But once we do know, we can choose to act. So it's not a scary thing to name racism. It's an empowering thing. Doesn't even compel you to act, but does equip you to act. And if you care about those on the other side of the sign, which is an if, but if you do, you could even talk to the restaurant owner, who is after all inside with you. And here we are with a city council person and you know, the city school board. And we could say, you know, restaurant owner, there are hungry people outside. Why don't you open the door again? Let them come in. You'll make more money. Oh, the conversations we could have. Or maybe what we'll do is try to pass food through the window, try to tear down that sign, break through the door. But at least what we won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat, because we'll understand something about the two-sided nature of that sign. So I will leave you all with this story, saying that we have to recognize that there are two-sided or multi-sided signs operating in our society today. It's not just the sign, it's the door, it's the lock, all of these structural factors. And when people talk about structural racism, that is what they're talking about. And we need to acknowledge the dual reality. And there are many, you know, I'll, during the discussion, maybe talk about what can we do about that. But I especially challenge those of you who have been born inside the restaurant to ask the question, how could you, born inside the restaurant, know something about the two-sided nature of the sign? Because there are many ways to know. So thank you for that opportunity to just give you that little story to illustrate that racism exists and how it operates.
Thank you very much. Dr. Callahan, do you want to pick up with that and talk about?
Absolutely, because there's a way you talk to children, stories, your own personal stories. We have to remember that there's a reality that our children learn eventually. And if we as parents and we as aunties or whatever relationship we have with the children, if we are not honest with ourselves and with that reality, then we will perpetuate a kind of wishful thinking that it's going to go away for our kids. And it's not, unless we are actively fighting against it. But I think in terms of the question about how to approach children is to, first and foremost, enter into a real state for yourself. And I appreciate Dr. Jones's blunt but very user-friendly way of talking about the two-sided nature of our society to children. The other thing I think that is really, really important, some things that we as parents fall into all the time, is we answer questions that they don't ask. So be very mindful stage-wise and developmentally that you respond to what the child is ready to hear at the time, depending on the age and stage of development. And I guarantee you that children will give you a clue, young people give you a clue as to what they're really ready to hear. If we overwhelm them with our own anxieties about what we're trying to relay by dumping. One story I always like to tell is a child asked the mom when they brought home their newborn baby, you'd appreciate this, Ms. Bowman, bring home their newborn baby, and the sibling is saying, where'd the baby come from? And the mother is like, oh my gosh, the sibling's about, 4 years old, and they sit down and they say, oh, I can't believe, how do I talk about this? And so there's a man, there's a woman, they kind of love each other. I don't know this. And, in the end, she goes through the entire, birds and bees kind of conversation parent has had to suffer under. And in the end, the child said, I thought they came from the hospital. And the question was, where did the baby come from? And that parent sort of gave a little bit more than what the child asked. So I think that that's just a general way in which to guard how we share. But the biggest thing is that it be user-friendly and that it be accessible language and using stories. There are many, many books, actually wonderful, wonderful books written by African-American artists and literary folk who have really captured what we're wrestling with, and telling the stories, reading books is very, very helpful. And then be prepared as best you can to love your child after the conversation. You will not, I guarantee you, be able to answer all of their questions because we're not even able to answer our own questions. So be mindful that there will be some things that you'll have to say, babe, I just don't know. But I love you and you're safe here with me. And really encourage that the child is safe with you, that relationship is safe.
And that's very interesting what you're saying, Dr. Callahan, because I know when I was talking to my little 6-year-old, and I'm going to come to you, Manikka, because as a parent of young children, to see some of your thoughts on this, but it was all I could do, and I probably didn't do it well, not to slip into a political conversation.
Yes.
Because I'm so revved up about all that's going on. I'm about to teach her the history of the civil rights movement and go back to when we came over in the boat. She's beginning to gloss over. And I think it's very hard sometimes, and for me, sometimes it depends on the day, not to slide into my own political activism when all she asked me was, why are they beating up on Black people? And I really took it down the lane. Vice Chair, did you want to add a little bit, because you already have young children yourself, and how is this impacting your family and particularly your girls?
Yeah, it's been interesting, and Dr. Callahan, that really hit me what you just said, because as I try to have conversations with my 6-year-old daughter and my 3.5-month-old that's just happy to be alive and has no clue of what's happening in the world right now, I do find myself oversharing. And so, this is going to be very helpful for me as it relates to listening to my child. And I'll even take it a step further with the work that I do with the Cambridge public school system. I think that there's often an intent versus impact scenario that happens in public schools, not just in the city of Cambridge, but I would say across the country, where adults, because we have not learned how to manage the complexities of this disease, COVID-19, as well as the health disparities that's attached to it. Now you layer on these protests, we dump our pain onto kids, and it is not a good thing. And so, as I continue to think about, my own child, the work that I do in the context of public education, it's how are we training professionals to engage young people in a way that you're listening to them, but not dumping the baggage of your own experiences in this moment, because we're all traumatized, onto young people. And I think that in the context of what has transpired the past 2 weeks, having our kids not in a physical building, particularly our Black kids, with maybe educators that have good intentions, but may not be able to handle the complexity of this moment, may have been a good thing, quite frankly, upside to, some of the things happening with COVID. So, it's a complex conversation, and I'm really appreciative of just that insight. And I'm going to carry that with me personally, as well as with my work on the school committee.
Dr. Jones, and first I want to say everyone's being tremendously polite. You don't have to be. Really look at this as a conversation. I feel like everyone's sitting here. Is it my turn yet? Please jump in. So Dr. Jones, jump in. What are you thinking here?
I am thinking that we don't want to overburden our kids, but we need to equip our kids. We need to speak truth always in our families and outside. At least Black families have always talked about the existence of racism, usually at a time when a child comes in and says, well, why didn't Sally want to play with me? Or why did they call me that name? Or why didn't I get that award? And so we've explained, you have to work twice as hard to be, recognized just as well, or, it says more about them and all. But we need to talk about the systemic piece. And part of our problem is that if we are reluctant to talk about racism as Black families, that white families are not talking about racism at all. And so then a white child grows up and then somebody says, well, racism is a problem. Then be like, well, no, it's not really, because if it were a problem, my parents would have talked to me about that. So we have to interrupt that right now. I think that age appropriate is fine. You're not trying to burden, but you're trying to equip. And we especially have to talk about our history. I had the experience when Black Lives Matter, after the killing of Mike Brown, and Black Lives Matter was so I don't know if that's 5 years ago now. And I was sitting in a class of first-year medical students. And one of them said, well, at least our generation is finally doing something about this. And I was like, where is the failure in teaching the history of the civil rights movement, and then teaching of movements before that, and then before that, and before that? And so we have to teach history in our schools, maybe in our churches, in community groups or whatever. We need to teach the reality, and the young people now who are out in the street, including the little 4 to 6 year olds, no justice, no peace. I don't know if you saw that went viral, but I'm not afraid of talking to them about the truth, because they need to know the truth, and maybe they can do more with the truth in their youth, and maybe than we can do now. We're now back up and we're supporting them. So I just want to say that there are 3 things we need to do as a nation, and therefore as families, as people, all of it. Name racism, then identify the levers which we can act. So ask the question, how is racism operating here? And then organize and strategize to act. I actually want to put out as a challenge to the Cambridge City Council, just as Somerville City Council just named racism as a public health emergency. I think they did. It would be lovely if the city of Boston, city of Cambridge joined Milwaukee County in Wisconsin, Dane County in Wisconsin, Allegheny County in Pennsylvania, Franklin County in Ohio, city of Pittsburgh, city of Columbus, naming racism as a public health crisis. So I'm done for now.
So Dr. Jones, not that I want to spoil it, the city council has their meetings on Mondays, and I'm happy to tell you, I'm actually a co-sponsor on this particular, we call it a policy order, doing just that. Yes! So well, it hasn't passed yet. Let's not get real greedy yet. Anything can happen. But we hear that, and we've done some other things that came up in our earlier conversation that we want to follow up on. But I want to hear from our panelists. Any other thoughts about what we've just said or heard? And I think we might even have a question in the chat. Any other thoughts? Claude?
Yeah, just really struggling between head and heart. So I really appreciating the first part of this, and just full disclosure, being a parent of 3, my wife and I, we have 2 teenagers and a youngest who's 12 and a half, going on 21, it seems. Just again, and as we speak, the family is out, at a protest, and here it is. I'm having fun-filled experience with you all. So I go back and forth. Again, the comment about Michael Brown, Ferguson, that was 6 years ago. If you imagine Charlottesville, that was 3 years ago. If you just think of what's happened over the last couple of weeks, and what's happened over the last 3 months. I mean, there's been this accelerator tied to COVID, and it's exacerbating the realities on the ground. So the fatigue is real, and what you're seeing manifest out there, conversations that we have with our own kids who are trying to figure out, well, how come we still have to stay home thinking about COVID, but now the message about, well, we still have to fulfill our civic duty. So I say that to say that it's not static how we approach this. I got to tell you, having my experiences here in the States for all the years, driving while Black, walking while Black, and mind you, again, the latest is we're talking about breathing while Black. I mean, this is the conundrum. So I say that to say that as I'm listening to this conversation, it does my heart good to know that we have this passion, this energy. It's complicated. The confluence of COVID tied to the reality of the Black experience in America is real. And so we do have frank conversations at home. I now have a 17-year-old who's a driver. I got to tell you the lessons that I had to sit down with it to tell him the do's and don'ts, all the things that we talk about in terms of what you do when you get pulled over, what you don't do when you get pulled over, that kind of stuff. So it's adding to this experience, and I appreciate this space. But I got to tell you that I'm listening, and I'm going back and forth between what my passion tells me, but also thinking about the role that I have as an agency head here in the city, and appreciating what we have in Cambridge, recognizing what doesn't exist in most communities across the Commonwealth. So just acknowledging.
Dr. Johnson, follow up on that.
Yeah, I definitely love to. Thank you, Chair, Department Head. Oh my gosh.
Denise.
No. I was going to say Claude. I was trying to
Claude. Okay, Claude. Hi, Claude.
All these formalities.
I know.
Right, Claude.
It's going to slow down the conversation. We don't have any problem being called by our first names. Let's just go for it. Okay, there it is.
That's a great lead in, because as I'm thinking about how I introduced the answer to my question, I really realized that one of the things that has to happen in a conversation about racism with our children and recognition in our own lives is that it comes with risks. So does COVID.
That's right.
But it comes with risks. And so when you talk about protests, when you talk about just living and breathing as a Black person, it's a life sentence, because you don't know at what point the intersection of your life and the risk that is racism will come and cost you a life, cost you some freedom that it hasn't already cost you. So I do believe that one of the things that is important to keep in mind, is sort of following up on Dr. Jones's comment, is that this is a systemic issue. This is a social issue. And so a lot of times in the mental health realm, what ends up happening is I've heard it, I have to tell you, 4 times in the past 3 days, people tell me, I thought it was my fault. I thought I was the one who was problematic, that something was wrong with me. And if you can frame it in a context that this is really an issue that lies outside of the individual, that lies in the sea and the ocean and that water that we swim and bathe and live in, that then the individual can begin to take a different position in relationship to that illness, that virus, that infection of racism, and empower themselves differently. And the reason I bring that up is because when we think about the protests and we think about sort of the isolation that we were sort of resigned to relative to the pandemic, that, we were trying to protect ourselves from a risk. And while it's certainly important to potentially do that, you also have to recognize that racism has its own risks. And so if we don't take active measures around managing and containing and calling out and identifying it, we are still standing at risk whenever the pandemic leaves.
Yeah. And yes, and yes, and yes, and yes. Because I think what I don't want you to think is that I was not saying that we should not prepare our young people and prepare our youth. It was the manner in which we do it. So truth, when I said to be real about the truth of what our reality is, you start there. You start with that truth. And a lot of times that truth is diluted in so many ways, such that people are beginning to blame themselves and so forth. We are a nation, we are a society that reacts. We have worked that muscle up, and it's quite developed. We are very reactionary. Something happens and we react. we have to do this, put the same amount of energy and the same amount of intentionality towards preventative measures. And part of that is actually equipping our children, equipping ourselves with what we know to be true. Risk assessment is something that we do all the time. In any activity, there's a risk assessment. And actually, it heartens me that people have an opportunity from pandemic to protest, have an opportunity to demonstrate their ability to do risk assessment about things that are particularly pertinent to them and that affect their own well-being and their own health and well-being. It's for a while, I thought that the Americans forgot how to protest. For a while, I thought that the fight had left us. I visited South Africa many times, and they have a dance called Toi Toi. It's their way of protesting, and they would ask me. This is years ago. I was going to South Africa around the HIV epidemic at the time, and then soon becoming quite global. And they said, "What's your Toi Toi? Do you guys have Toi Toi?" And for a while, I had to admit I hadn't really seen the anger bubble up to the point of a demonstration of a Toi Toi, a real protest. And when we begin to lose the ability to fight in that way, when we become numb to the realities of racism or whatever, then that is when we are really on the verge, and that we've gone beyond sometimes repair. And I was heartened by the fact that we really were presented with an opportunity to do a risk assessment and say, this is too important. This is too important for me not to say something. Now, you don't all have to be out in the protest. I'm of that age, the gray hair. Well, I had to do my risk assessment. I'm a physician. I need to be there for my patients. Mm-hmm. But in any regard, there are many ways in which you can join this outcry that enough is enough, and it's something that we all have to do and we all should do.
Yeah, I want to jump in there because this is the question that's been like really burning inside of me. Like, I did that risk assessment. I'm a new mother to a 3.5-month-old child, and I'm also a clergywoman, and I started my career at the intersection of the moral voice and public life, right? Mm. And so here we are in a pandemic. We are, COVID-19, it is beautiful to see all the people, particularly a high percentage of non-Black bodies in the street saying that Black Lives Matter. But I feel like this happened so quickly that conversation around risk assessment really, I'm not sure how we had the conversation, or we're not having it in the public sphere in a way that I think would give people the tools to really make some of these really hard decisions. We went from COVID-19, stay at home, social distancing, to boom, everybody in the street right now, raise your voice, have a mask on, socially distanced. Some people are not, people are screaming to the top of their lungs. And there's a lot of risk there. And while young people may be healthy, they have to go back to a community. And so I guess my question, to our healthcare professionals, how should we be talking to our community about these risks that are still very much so real, even though the mainstream media is not talking about COVID in the same way anymore? The threat is significant to Black communities particularly. So how do we manage these risks? How do we have this conversation?
Anyone?
Just I'll tee it up and others will chime in. So in the end, what you're describing is the biggest challenge that we've had over these 3 months. We're in public health, we're in a discipline that tends not to move at the speed of change. The COVID experience has been an accelerator, and you touched on it, that we just have not had the time. That being said, there are measures in place. We have messaged again around the importance of being at least 6 feet apart, about masking up, about making sure that we apply hand hygiene, cough etiquette, the whole 9 yards. So it's not that the information hasn't been out there. The challenge here, as you're touching on, is the fact that right now, the momentum, the flashpoints that we're seeing around protests, that didn't start 2 weeks ago. This has been brewing for some time. And so it's very difficult to fight gravity, because literally that's what we're experiencing now. But I would say to you that in the end, in this conversation and beyond, there is an opportunity to remind folks there's still a storm out there tied to COVID. there's still this very communicable virus out there tied to COVID. We do need to be very wise. While folks want to engage and demonstrate and exercise their civic duty, we have to be responsible. So thinking about how we juggle these relative risks, I got to tell you, we had the conversation at home. So my family member, my spouse, the kids, yes, they're out there demonstrating, they're protesting, but at the same time, I'm here in this for. So you can walk and chew gum at the same time, but I would say there is an opportunity to remind folks that there's still a storm out there tied to COVID. It's not an either or as much as it is being mindful. One last example, choirs, right? So we now know more evidence around how this virus can spread and recognizing the hazard tied to choir practice. Who would have thought of that? Well, we now know that just because of the mechanics and just how this virus is spread. But I say that to say we did not know that 3 months ago. We have more science, more proof, more evidence now, and it goes to the messaging in our community. So I just want to acknowledge that it is hard. I hear in your comment, just you feel burdened recognizing your moral compass and what you'd want to do, but it's also about what we ought to do given the times that we're in. So I appreciate.
Anyone else want to chime in on that?
I would love to.
Dr. Jones?
Yes, so pulling together a lot of these amazing threads. First of all, we don't all have to be at the protest, or at least not every day. So each of us has a toolbox, but each of us needs to be pulling at least 1, 2, or 3 tools out of our toolbox right now in this moment. So, you know, us being here on this CCTV thing is we're using our tools. But the other thing is, so the harm reduction, this is what we're at, you know, risk reduction, harm reduction. So I think it would be lovely, for example, if the President of the United States would invoke the Defense Production Act for the production of PPEs, like he's invoked it for, you know, ventilators a little bit, but for meat, you know, to say that meat was essential, but for PPE. And what if we could equip all demonstrators with you know, an N95 mask? Like, so that would be like a real thing. What if Congress demanded that, so that not that you shouldn't demonstrate, but that we should be demonstrating protected. So in the meantime, you could have a 2-layer, so it's going to be the kind of mask you're wearing. Right now, just any cloth covering is protecting other people around you. But if you have a cloth covering that has 2 layers and you can put maybe a coffee filter in there, you can increase how much that mask is also going to protect you. Maybe we shouldn't all be shouting so much. Maybe we need drums or tambourines or some other noise makers. We should try to do the social distancing. Maybe cities should set up hand sanitizer stations, you know, at all 4 corners, every 3 blocks apart. You know, there are things that we can do to support this moment and reduce risk. And the young people have to recognize they should not go and hug grandma right now. So they need to be cognizant about the people they're around. And in Atlanta, the suggestion has been made by the mayor that people who've been at protests go and get a test. So then we need to enable, and maybe the President of the United States should invoke the Defense Production Act to have more tests available, because that still hasn't been used in that way. So there are many things that we could do, not to, because none of us is saying don't protest. We recognize that the increased risk to the individual is not outweighed by the opportunity, if we press at this moment, at this crossroad, to make things better for our children and grandchildren. This is not an individual risk calculation moment right now. The opposition is staunch, and we recognize that they're very invested, but also with the way that things are moving now, I have a feeling I was too young the first time to be actively involved. So this is the first time in my life that I'm feeling the promise of this moment. And it's not going to be instantaneous. And after we name racism, we need to identify the mechanisms in our structures, in all of our elements of decision making, the who, what, when, where, how, and why. Where structures are the who, what, when, and where of decision making, especially who's at the table, who's not, what's on the agenda, what's not. The policies are the written how of decision-making, practices and norms, the unwritten how, values the why. So we need to name racism, ask how is racism operating here, and then organize and strategize to act. When the protests are done in 2 months, we need to be voting. We need to right now be understanding what we're trying to put on agendas. All of that has to be happening right now.
Excellent, excellent. I see that there may be some questions out there. Manikka, can you bring them up and put them on the floor for us? You're muted.
Sorry. So one of the questions that we have, it goes back to young people and engaging our young people. One person mentioned that they have a child that is mixed race. And, how do we have these conversations in the context of mixed race families? We have another question really asking about a teenager that is a teenager of color. Doesn't specify if the kid is Black or not, but a teenager of color, and trying to figure out as a parent, how are we having these conversations with young people as it relates to managing the anger and the stress that's involved in this moment?
Anyone want to jump in on that one? Dr. Johnson? XENIA?
So this is something that particularly applies to adults and to children, but oftentimes what goes unnoticed is the trauma that happens when you're in a society where racism seems to be perpetuated and unrestrained. And oftentimes that trauma, it doesn't look like what you might experience, what we know as sort of like the shell shock or the Vietnam vet. It really looks like you being shy, being reserved, irritable, having difficulty concentrating, difficulty with sleep. And it also lives in our bodies. We hold stress in. So we might be more tense. We may have more headaches. We may have more GI upsets. So the way to potentially one is recognizing, right? Recognizing that this era that we're in, where the elevation of racist tones, racist experiences, racist exploits are coming fast and furious, and it's hard to kind of dodge them fast enough to not be impacted by them, so that our children as well are likely going to be impacted by them. And some of that is going to translate into emotions and translate into function, translate into bodily symptoms. The one way you can do that is you can sort of contend against that is to actually release the toxins from your body. Get moving, stay moving, get into a dance, get into a gym. Even soaking in a bath is enough to begin to dispel the toxins that this kind of trauma can create. Now, it's such a simple and probably removed remedy for something so inundating and so overwhelming. So there's so many other layers to this, but certainly something that everyone can do, and trying to relieve themselves from the stress and the pain and the assaults that come at us racially every day.
Thank you. Anyone else want to weigh in on that question or answer?
I'd like to, the impact on the body. I'm glad you brought that up, XENIA, and I'm glad that, we understand that children do respond a little bit different. Their outward show of stress is a little bit different, but we all suffer from it. We all suffer from it. We know, we have had recent studies about adverse childhood experiences, right? Racism is an adverse childhood experience. It is, and it has had generations, decades, generations of an impact on our genetics. This whole study now of epigenetics and how it actually changes the expression of certain genes within our bodies that is transmitted from generation to generation, and makes it more difficult for our offspring to be able to mitigate against the ills of racism. And I know we keep coming back to racism, and I appreciate that is a huge component, but we have to also remember that wellness is multifaceted, right? Multifaceted. It is interdisciplinary. And in order to move our young people or ourselves towards wellness, we have to understand that it impacts every area that we know to be necessary to be sustained and to be truly human, all of the areas. And one thing I want to bring out is that we are learning a lot about the impact of COVID, okay? We know that it disproportionately negatively impacts certain groups of people. We know that. We know that racism, and we know that the impact of systemic racism has a large part to do about it, right? But we have to be careful not to put all of those eggs in one basket, because some of the studies that are now coming up is showing the effect of the severe impact of COVID illness on the elderly in particular, because of low vitamin D levels, because of inadequate B12, because of low magnesium levels. These are some things that we see in our Black community because of the nature of our genetics somewhat, okay? And because not only that, with the low vitamin D being more common in people of color, but nutrition, right? Nutrition. So systemic racism has a lot to do with our access to decent food, our access to quality healthcare. It has a lot to do with that. We need to keep that in mind, that these are interconnected. All of these things are interconnected. And the other thing is that we do have some power over changing some of those aspects without completely bringing racism down. Now, we ought to be headed that way until it comes down. Okay, we need to, but in the meantime, we've got to mitigate what's happening along our way. We need to make sure that our children are eating well.
Mm-hmm.
Have to make sure that they are getting food that is rich in micronutrients. We have to make sure that that magnesium level is really truly in that food source. We need to ask where that food source, where it was grown, where did it come from? We need to begin to think about growing our own food. So these sound like small tidbits, but it's more than that. It's how do you mitigate while we're fighting? We have to survive. If we don't survive, right? If we don't survive, then it doesn't matter what happens down the road. We've got to survive this. So we need to mitigate the stress, the impact of stress on our bodies, on our wellness, and we have to realize that it's really interdisciplinary. We cannot just hone in on just racism, although racism covers a lot of areas. We have to look at what is in our hand and what we can do to mitigate some of the toxins that we are seeing. So I'm always fond of ways in which we can address things as a group, but we have individual responsibility as well to be well and to do what we need to do to stay well and to perpetuate that among our families as well.
The whole question about nutrition is so important. And then you think of how we as a community have access, how well and how often do we have access to good food that is affordable? So I'm not going to call the name of some of our supermarkets that are in our neighborhoods that most of the people that I know can't afford to go there, because $10 gets me one bag at this store, and $10, I'm probably too low, gets me 3 bags at the other store, but I have it full of SpaghettiOs. And what did one of my friends have? She said, well, I got good food. I have pasta. And I said, you do? And she says, yeah, I have raviolis in the can. And I said, oh my Lord. and so it's not, you're right about the eating well, but being able to afford to eat well, it also is something that we have to deal with. Now, Manikka, I think I saw a question specifically to Dr. Callahan. Do you have that in front of you?
Let's see. I did, and we did answer that question specifically.
Okay.
Yeah, we did. But there are a couple of other questions are coming in right now. One is to myself and Claude, actually, questions around how are we thinking about supporting young people if schools reopen in the fall, particularly with the public health crisis and now this very big conversation that's happening around race. And so just to answer some of those questions on the school committee side, we were very fortunate in the city of Cambridge where other municipalities were in a position of they're laying off people and have furloughs. In the city of Cambridge, we actually added $11 million plus to our school budget. And in that budget, there was an allotment for social workers to really think about, how are we going to be meeting the needs of our young people as they come back into the school building. And so we are very much so thinking about that. And also, trying to manage the impact of COVID, now this piece around racism, which we've always had in the back of our minds, and putting policies and implementing programming to tackle it. However, what's happening now in the world is vastly different from anything that we were equipped from a programmatic perspective. And so really looking forward to working with our educators to figure out how are we positioning them to be responsible in their conversations with young people, because our educators, was trained to teach people how to read, teach people how to, write, learn math, science, and not until more recently, some universities and academic institutions are really starting to integrate in this piece around the impacts of race and the intersections around education with it. And so some people are equipped with that because they've been trained in it more recently. And some people have been in our school system for years and they just don't have those types of insights and trainings. And so we're trying to manage towards that from a systematic perspective. But I'll let definitely Claude jump in and give some insights on how we're in partnership with the public health department as we think about reopening schools in the fall.
Thank you. Yes, just acknowledging that we have a strong, robust partnership between the Cambridge Public Schools and the Cambridge Health Alliance. We have strong linkages, in particular, to the psych department. So through the work of our department at the health department, linked into psych and our partners at not only in schools, but also the Department of Human Service Programs, just know that the conversations, the planning continues, recognizing that has not been a blueprint for this, but yet we have these resources that we've leveraged. And I should also remind you that we've gone through a systematic process as a city. We've identified the health priorities for the next 5 years. We are a nationally accredited health department, which requires having these priorities. And just know that mental health is one of those 3 priorities that we've signaled for the next 5 years. And so healthy eating, active living, and community and social resilience are the other 2 priority areas. So it dovetails with what we ought to be paying attention to. So just know that folks are thinking a lot about how we can support the behavioral health needs of children going back to school. I mean, the climate these days is very different from when I was in grade school and high school. And that was before the advent of social media and all the other distractions that are bombarding our kids. And so just know that we do have already in place a strong partnership through the Cambridge Health Alliance. It's anchored not only to the psych department, but the different departments at CHA, including pediatrics, family medicine, internal medicine. So just know that we have quite a village that's here at the ready to support the kids before they go back to school.
And I just want to add one more thing before I give the next question. I want to just affirm everybody in this conversation, because when I think about the role of education and the mental health piece, we're putting these things in place so our young people can be us one day. Oftentimes I think that gets lost. Like education, the foundation of education is to position young people so they can enter the world and have impact and follow their dreams and their aspirations and be functional adults and be successful. And we know when it comes to Black and brown kids, there's a disconnect there when it comes to really systems being able to position them to be successful in their endeavors long term. So, these interventions is being put in place to make sure that they're mentally sound and have what they need so they can learn is really important right now in this COVID moment, in this moment of racism, because I want our young people to continue to grow and have opportunities. And the way they do that is by having access to quality education. Mayor, I remember Councilor Simmons is mayor because she was mayor when I first got elected to the school committee. So I call her mayor all the time. But Councilor Simmons, someone asked, how can activists and organizers help with your efforts to declare racism a public health crisis in the city of Cambridge?
So the good news is it's before the council on Monday night. And so for folks that are within our earshot, call to the city council on Monday after 5:30 and testify to say how that's important. That's number one. And that's going to be important. There's an idea that Dr. Jones gave me around trying to get people to get tested and then equipping them with thermometers and oximeters and things of that nature. We're going to work on that. So pay attention. This is where it gets political. You really have to pay attention. And now it's so easy. Dial into that Zoom meeting. Have your voice heard. Let people know what you're thinking. And so that is going to keep our feet to the fire on the work that we're doing, but also those of us that have always been doing this work, it keeps us fortified, that we're now out here by ourselves trying to push this big boulder up the hill. this is just so exciting. I want to keep going at it. I've been told that we have about 2 minutes left. So in 2 minutes, and I want to have my colleague close us out to talk a little bit about our next discussion, but to our panelists, and Dr. Jones and Dr. Callahan, you both have said this. I think all of you have said this. What do we do next? How do we continue to keep this going forward? And I know 1 minute is not nearly enough time to do that, but give me your 1 minute. This is what we need to do to keep this moving forward.
Okay, so I was struck. I wanted to respond to Manikka and about how some of the teachers aren't equipped to talk about racism. So I wanted to say that there's a resource. I did a TEDx Emory. If you Google my name, CAMARA Jones, TED Talk, you'll get to an 18-minute video with 4 different teaching stories that teachers could not only look for themselves, but share with their students of all ages. I wanted to quickly say that racism is a system of doing 2 things, of structuring opportunity and assigning value. Based on what? Based on so-called race, the social interpretation of how one looks, that has 3 impacts. It unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. And I also want to say that my intent is that this revelation about racism that came with COVID-19 and the murder of George Floyd and Breonna Taylor and Ahmaud Arbery and all of the ones behind them, we cannot let people slip back into the somnolence of racism denial. And so if I had another minute, I'd tell you 7 ways that is operating, but we cannot focus. 3 things. The narrow focus on the individual we have in the society, which makes systems and structures invisible or irrelevant. We need to teach around that. The fact that we're ahistorical and act as if the present we're disconnected from the past, and as if the current distribution of advantage and disadvantage were happenstance. We have to move around that. And the endorsement of the myth of meritocracy, that if you work hard, you will make it. We have to say, yes, most people who make it have worked hard, but many other people are working just as hard or harder who will never make it because of an uneven playing field.
Thank you. Dr. Callahan.
Yeah, so the ditto, and the history piece is so important. We have a little trouble with applying what we've learned. So historically, what has worked and what has not worked, and looking very carefully at that. So I think going forward is to keep history in mind. The other thing I think is to look at what's happening with the next generation. Think of it as the same way we think about sort of substance abuse use. Like we are recovering community from racism, from decades of racism. And we have to begin to look at how we as individuals survive that and how we thrive and how we move forward. We don't want to return to anything, okay? We don't want to turn back in any way, shape, form, or fashion. We want to look and propel forward. And we need to have those things in place to do that. And my sense is that, I know that Dr. Johnson didn't get to talk about her race recovery, but I see race, it's a race recovery. We have to reclaim what we have lost, and then not make the same mistakes, not go back, but go forward with what we've learned. And so I don't have a minute, because I need more than a minute, because it takes more than a minute to really understand how interconnected all of this is. But if I can end in one thing, it's history. Let's learn from what has happened in the past and do something differently. Let's just do something. Let's not do the same thing differently. Let's do something different. There's a big difference between that.
Thanks, Dr. Callahan. Dr. Johnson, and then Claude.
Thank you all again for the invitation. So I would say, mental health has this stigma, and as the mental health representative on our panel, the stigma even is compounded when you look at race, because Black people have felt hidden in the shadows for so long. And so that coming forward with their needs, coming forward with their struggles has been very difficult. So I say, as a suggestion to the city of Cambridge, that I follow Dr. CAMARA Jones's recommendation that their thermometers be given to every family, whether they're positive or not. Because I think if you begin to tell the families that they're being seen, whether they call out to be seen or whether they identify that they need to be seen, they will feel seen. And that translates into a positive self-image, positive self-advocacy that you'll start to see translated into so many different other areas of their life, particularly health, but then also in the systemic structures that exist that we need to combat. So I would offer that. And I'm this big proponent of wellness. I believe in mental wellness before mental illness, because if you can have a basis of mental wellness, you can combat more than anything you can imagine. And so there's a platform in, and I'm not going to plug, I know Dr. Callahan didn't intend for me to do this, but I'm going to plug the work that she's doing around wellness. There is the Wellness Collaborative that is designed for strength-based and holistic care that heals and makes well. And it really is a beautiful community and beautiful model for recovery around this time of pandemic. So I'd offer that.
Thank you so much. Claude, we're going to hear from you, and then, so I want to say thank you now. Each of you could be a show in your own right. This has been so packed with so much information. We have to figure out how we do it again, but we're going to collect the notes and try to make it available as possible we can. Claude, I'm going to turn it over to you, and then Manikka, if you could close us out. And again, thank you so much for your time, your intelligence, and your willingness to work with us as we try to spread the message out. Claude?
Yeah, just things. Thank you again for this opportunity. So at home, we remind our kids of their family roots. We let them know that racism is real, and we support them in their resilience to bounce forward, not just bounce back. To the broader community, I would say just 3 reminders that through this COVID storm, yes, maintain the appropriate social distance. We try to manage as much as possible this fatigue, paying special attention to the wear and tear emotionally, but at the end of the day, mask up. This is changing norms, changing the way that we do business, changing the way we interact. So I would just remind folks of the importance of complying with these requirements and these measures, at least keep each other safe. So with that, I do want to applaud the city's leadership for investing in this space. I do want to thank our co-facilitators for this invitation. And I really can't say enough to my colleagues for entering into this space, having this conversation in this living room. And I really want to go on record to say our team stands at the ready at the health department. Yes, we are doing our best to try to support residents and partners and colleagues across the city. But at the end of the day, we're all in this together. So really just want to thank our team, our fantastic team, the leadership, the city manager, Louis Di Pasquale, the mayor, Sumbul Siddiqui, and our commissioner, Dr. Assad Sayed. So really just want to acknowledge their commitments to supporting our work on the ground.
So Manikka, my colleague in crime here, or in health,
Yes.
Tell us about what's next. And
well, everyone's comments, really, the road leads right to our next conversation, which will be an intergenerational conversation regarding COVID-19 and the Black community. I think particularly now with the intersection of this virus and what's happening as it relates to this conversation about Black lives, now is such an important time for our community across generations to come together to have this important conversation. So we will be back here in 2 weeks, same time, same place, and we'll let you know that list of individuals that will be joining us for the conversation. And I want to just highlight one last thing before we get off the call, which came up. Dr. Jones mentioned a recommendation from other communities, and I think it's really important when we talk about COVID-19 and the health of the Black community. We're going out there, we're protesting, and I know Councilor Simmons will take some of those recommendations when it comes to what the city can do to ensure that public protest is supported in the context of a pandemic. But I really want to talk to our community and say, hey, if you know that you're going to be going out and you're going to go back and you're going to be interacting across generations within your own family, think about getting that test. I know in the city of Cambridge, they are available through the Cambridge Health Alliance, and it is available to you. And so this is a way where we can do both and I just want our community to hear that. We will continue the fight for justice, and at the same time, we're going to care for our families, those that are most vulnerable amongst us, and those two things can be in the same space with each other. So thank you, everyone. More to come, and we look forward to having more conversations.
One more thing you said that's important. We are doing COVID-19 testing Monday through Friday at the East Cambridge Health Center at Gore Street. So testing, when you said testing is available, and a message to our listeners, please know that, tell people, go get that test. And I hopefully we'll have a thermometer for you when you actually go. Again, thank you. Thank you to Susan Fleischman and Sean Eiffel and Marissa Grooms for our technical help that makes this happen, to Neil Alford that been fielding us the questions. Without them, we could not have done this. And again, thanks to all of you. You have been wonderful. And thank you for all that have viewed. Bye-bye. Good night.
Right.